Namaste. Welcome you all for this yoga session. In this, we are using a chair, a mat, and a blanket. We are going to do some postures for the hips, which will obviously help the pelvis and the lumbar region also. Before we do some of these postures, start with some preliminary movements. Lie on your back, resting the legs on the chair. Allow the complete spinal column to rest on the mat. Feel the complete length and breadth of the spinal column. Feel the paraspinal muscles. Keep both the palm on the abdominal cavity. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. This is a very, very important thing. This breathing has to be maintained throughout. Slow inhalation, slower exhalation. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Now raise your right leg up, pull the kneecap, stretch the heel, toes towards the knee, straighten the quadriceps, top of the thigh. Feel the stretch in the back of the thigh, the hamstring muscles as well as the calf muscles. Right leg down, chain, left leg. Stretch the heel, pull the kneecap. Keeping a chair and putting the legs on top of the seat helps to ease the flow of blood from the lower extremities towards the heart. Left leg down, one more time, right leg. Pull the kneecap, stretch the heel. Feel the stretch in the hamstring muscles, in the calf muscle. This is a so-called flexion of the hip. While keeping the knee in extension. A good way to tone the muscles of the thigh and the leg. Right leg down, chain, left leg. Pull the kneecap, stretch the heel. The thigh muscles get into a good tone, and thigh has a important role to play in the health of the lower back. Left leg down. Fold right leg. Hold the knee from both hands. Press the knee closer to the chest. Stretch the heel, toes towards the knee. Pull the right knee closer to the chest. So from both hands you should pull it close. Breathe consciously. As we inhale, abdominal cavity should expand. As we exhale, it should contract. So that breathing, especially in this posture, gives a nice massaging effect to the intestinal organs. Release right leg, chain, left leg. Fold, hold the knee, press the knee closer to the chest. This is a simple stretch for the gluteal minimus and medius muscles, that is the muscles in the hip. They get a good stretch. Stretch the heel and then tighten the corners of the left knee. For that you have to squeeze the hamstring muscles against the calf muscle. Then you feel the fascia of the knee capsule, how it gets a good stretch. Release left leg. One more time. right leg. Hold the knee, press the knee closer to the chest. Stretch the heel, toes towards the knee. Then the fascia, that is the thick skin covering the knee capsule, that should also be made active. It has a very important role. For that you have to squeeze the hamstring muscles, the back of the thigh against the calf muscle. Then feel the tightening effect of the inner corners of the knee. Release right leg. Left leg again. Fold from both hands. Hold the knee. Press the knee closer to the chest. Do not move the knee out of the plane. When you pull the knee inside, you should take care of its orientation. Breathe consciously. Feel the posterior region as we inhale and exhale. Even the posterior skin responds to the breathing. Release left leg. Right leg up. Fold from left hand. Hold the ankle joint. Pull the heel closer to the root of the left thigh. From right hand, push the knee. This is a good posture to mobilize the base of the spine, especially the sacroiliac joint, where the spinal column articulates with the hip bone. Release right leg, change left leg. Left leg up, fold from right hand, hold the ankle joint, pull across the right thigh. From left hand, push the knee. Even here, on the left leg, you got to tighten the hamstring muscles against the calf muscle so that knee capsule feels that gripping stretch. With every inhalation, exhalation, you should feel the base of the spine. Release left leg. One more time, right leg. Hold from left hand, fold it across. Take the heel close to the root of the left thigh. But how close you can come depends upon the knee joint. If it is too stiff, then maybe you can move the heel a little up, else you can pull it as close. From right hand, push the knee. As you inhale and exhale, feel the base of the spine. Release right leg, chain, left leg. Hold it across, taking the heel closer to the root of the right thigh. From left hand, push the knee. Feel the base of the spine, feel the region of the hips, feel the lower back, feel the complete abdominal cavity as we inhale and exhale. Release left leg, right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. You have to pull strongly and push strongly, but ensure that the pelvic rim does not rotate. You must restrain that and push the knee across the chest. Breathe consciously. Release right leg, chain. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. You have to pull and push rather strong so that you can feel the stretch in the gluteal muscle group, especially the gluteus maximus muscle, one of the major muscles in and around the hip. So the tone of these muscles have impact on our walking, running. Now release left leg, change. One more time, right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. Feel the stretch. We are stretching one of the major muscles of our system. Feel also the lower back as we inhale and exhale. Feel all the thick skin, the fascia at the lower back expand and contract as we inhale and exhale. Release right leg, chain, left leg, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. You should use the strength of the arms in this posture so that the gluteal maximus muscle gets a good effective stretch. It is also important to hold the stretch for a while, or at least about 20 seconds. So just mere movements does not help. Staying in the posture with good breathing is equally important. Release left leg. Slowly get up from the right side. Sit on top of the chair. Sit to the front. Now turn to the side. Turn to your right side. Sit upright. Hold the top of the chair. Inhale, exhale, turn. Chest up, navel up, stretch the spine, keep both the shoulders even, turn the cervical spine also in the direction of the twist. With every inhalation, stretch the spine up, with every exhalation, twist the spine and watch your breathing. As you inhale, abdominal cavity should expand, as you exhale, it should contract. Keep the foot firmly pressed on the floor. Turn well. This is very good for the lower back, the rotators there. They get a good movement. It's a good way to remove the stiffness in the lower back. Chest and navel up. Do not hold the breath. As we inhale, slowly come up. Sit to your left side. Press the foot firmly, sit upright, hold the top of the chair, inhale, exhale, turn. If your leg does not reach the floor, you can keep something between the floor and the foot, maybe another blanket folded or bricks. Twist the trunk, chest and navel up. You can see that maximum rotation comes from the neck, followed by the upper back, thoracic region, then the lumbar. Use your breathing. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Contract the abdominal muscles little more than normal so that the abdominal organs get a good massaging effect. So this posture also helps the abdominal organs to get rejuvenating movement. Slowly come up. Sit upright, sit slightly to the front, chest and navel up. Now inhale, exhale, bend, taking the right hand down, lock the right upper arm to the left knee and grip the foot of the chair from the right palm. Take the left hand up, hold the top frame of the chair, inhale, exhale, turn. You have to stretch the spine, twist the spine. So there is a little tilting of the spine or bending of the spine in the forward direction, then there is a stretching diagonally, then there is twisting. Breathe well. This gives a further enhanced stretch, especially for the lower back. Do not shift the position of the hips. Now slowly come up. Sit upright, change side. Inhale, exhale, bend from left hand, push. Hold the chair to accommodate. The twist. Take the right hand up, hold the top frame of the chair and twist. And you can open the right shoulder so that the chest can also twist further by moving the grip at the right hand as far down along the frame as possible. But do not hold the breath. Breathe well. Feel the twist. Feel the stretch. So this twist creates more freedom in the lumbar and the pelvis region. Slowly come up, sit upright, stand up, keep the chair in front, kneel down, sit on your heel, now take your left leg back, right leg forward, bend your right knee, chest and navel up, hold the chair from both hands, chest and the trunk. The center line should orient towards the chair. So that's why holding the chair gives you a good reference. Breathe well. As you inhale, abdominal cavity should expand. As you exhale, it should contract. Press the right foot. The angle between the right calf and the right thigh should decrease to the minimum and stretch the left leg back. Maintain the line and length of the left leg. Do not move the left foot out of the line. So maintaining that orientation is very, very important. Feel the gluteal region, feel the lower back region. In this, the hips get into a differential movement. Slowly come up, then chain. Right leg back, left leg forward. Inhale, exhale. Flex the left knee. Release the groin as much as possible. Sit upright, chest and navel up. Chair gives you a good support to rely upon, a good sense of direction to orient yourself, a good sense of anatomical symmetry can be obtained by using the chair. You can stay for a longer time. You can make the posture effective. In this you can see the left hip is in flexion, right hip is in extension. This is also a good movement for the hip flexors. The base of the spine gets a lot of benefit in this because of the differential movement that is accomplished in this posture. Slowly come up. This is also good for your ankle joint. Join the legs, sit on your heels, sit upright. Stand up. Stand upright. Foot 6 inches apart, then raise your right leg up, right foot on the chair, stretch your left foot back, foot pointing backwards, back of the toes resting, left leg absolutely straight, hold it out of the chair, flex the right knee completely, left leg straight, chest and navel up. Here you can see the right hip is in flexion whereas left is in extension, and the right foot is in dorsiflexion, left foot is in plantar flexion. Check and experience the orientations. Left leg absolutely straight. Chest and navel up. Orient the trunk and pelvis properly. The left foot as a downward stretch. Feel that. Now slowly come back. Take your right leg down. Chain. Left foot up. Right leg back. Hold it out of the chair. Flex the left knee. Right leg absolutely straight. Note the position of the toes on the right leg. Feel the stretch. So this also helps your foot musculature. Remember, both the foot together have nearly 25% of all the bones in the body. Right knee straight. Watch both the hips. Watch the base of the trunk. Chest and navel up. Be present in the posture. It is very important to experience the posture. Should not do it mechanically. Slowly come up and bring the left leg down. Stand upright. Right foot up. Again, hold it out of the chair. Stretch your left leg forward. Left leg absolutely straight. Orient properly. And then rise both arms up. So now you are using your self weight completely. Right foot firmly pressed. You can see the angle between the right foot and the shin bone. That's why we call it a dorsiflexion. Less than 90 degree. On the left side you can see the angle. It is almost 180 degree. Plantar flexion. Slowly bring the arms down. Right leg down. Then chain. Hold the top of the chair. Left leg up. Left foot firmly pressed on the seat of the chair. Right leg stretched back. Right toes pointing backward. We'll open the chest, orient the trunk and then stretch the arms up. Palms should face each other. Keep on stretching the arms. Right leg absolutely straight. You can also see that the left knee is in flexion whereas right knee is in extension. And the left hip is in flexion, right hip in extension. You should experience all these movements. Chest and navel up. Also be focused on the breathing. You should develop that feel for the posture. Bring both arms down. Hold the chair. Bring the left leg down. Stand upright. Feel the region of the hips. Take your right foot up, left leg back stretched. Now twist the trunk. Lock the left elbow to the right knee, and from left hand hold the junction of the chair. Well open the right shoulder. Keep the right hand on the waistline. Slowly come up. Then take the right leg down. Chain. Left leg up, right leg back. Then you are going to twist, taking the right arm, right elbow to the left knee, right palm to the junction of the chair, left hand on the waistline, turn. So you are combining the differential movement of the hip with the twist of the trunk so that it involves all the other muscles. So these hybrid movements involve many other muscles. Slowly come back, sit down, join the heel, sit on your heel, keep a folded blanket right in front of the chair. Knee on the blanket, sit on your heel, sit upright. The variety of movements would engage the multitude of muscles we have, and that gives a better health to the muscles, bones and joints. Now hold the chair, kneel down on your knee, take your right leg up, right foot at the center of the seat, hold it out the chair, knee and thigh not resting on the chair. Left thigh perpendicular to the floor, left leg on the floor, but keep it active. You should stretch the foot, toes pointing back, chest and navel up. This is a good sideward movement for the hip. Also helps the knee. Keep the trunk upright. Breathe consciously. Feel the region of the hip. Right leg down. Hold the chair, left leg up. If you can't lift it just like that, you can take assistance from your arms in pulling up. Rest the left foot on the middle of the chair. Rest of the leg, thigh and knee not supported on the seat of the chair. chest and navel up. A good sideward movement for the hip. Hip is one of the major joints in our system, very strong, stable joint. It has got a variety of movements, and the muscles in and around, they connect to the upper back, also thigh, lower back. So they are all in a kinetic chain. So having a healthy hip with all the associated muscles, ligaments, tendons is very, very crucial in having a good lifestyle. Bring the left leg down, sit upright. Always keep the breathing relaxed, be calm, be attentive, be focused. You should bring the mind to the presence. So use the posture to help the mind to anchor onto the present. One more time, kneel down, take your right foot up, right foot at the center of the seat of the chair, hold the top of the chair, chest and navel up. Inhale, exhale, slowly tilt the trunk. Do not flex the trunk. You should tilt the trunk. Chest and navel up. So now watch the deeper regions of the right hip. And also tighten the right hamstring muscles, again at the right calf muscle. You should also engage the knee capsule. Even on the left side, you should stretch the toes, tighten the calf muscle. Breathe well. So deeper muscles of the hip get a good stretch when you tilt the trunk without buckling the spine. Slowly get up, bring the right leg down, chain. Left leg up, left foot at the middle of the chair, chest and navel up. Slowly as you exhale, tilt the trunk, taking the head towards the top of the chair. Keep on stretching the spine as if you are lifting the spine from the base, whereas you are pulling the base down from the hip. So that stretch helps in reaching the deeper regions of the hip. And all these good movements gives a nice massaging to the bones and the joints and the other cartilaginous materials, because they are all living tissues. The health of the joint depends a lot on all these things. And staying in the postures further helps not only the muscles but also the bones to become healthy. Slowly come up, bring the left leg down, sit upright. One more time, kneel down, take right foot on the chair, chest and navel up. Slowly bend forward, taking the trunk into the top rim of the chair. You can relax the arms. Again here watch the right hip. Tighten the right calf muscle against the thigh muscle. Feel the right knee capsule. Keep the left leg also active. Breathe consciously. Slowly come up. Right leg down. Chain. Left leg up. Left foot at the center of the chair. Keep the left thigh and knee active. Right thigh, leg, foot also active. Now inhale, exhale, bend forward. Take the trunk underneath the top rib of the chair and relax the arms. Stretch the spine. Breathe well. The foot presses against the abdominal region, giving a nice soothing massage as we inhale and exhale. So experience the posture. Keeping the mind focused and attentive on the posture is very, very crucial. So don't perform mechanically, but don't have a divided attention. An unbroken attention is very, very important. Slowly come up. Hold the chair, bring the left leg down. Sit on your heel, sit upright. Support of the chair also helps in strengthening these joints and bones. One more time, kneel down, right foot on the middle of the chair, chest and navel up. Now inhale, exhale, turn the trunk, taking the right hand down. Hold the foot of the chair from right hand, left hand on the waistline, turn. As we inhale, abdominal cavity should expand, as we exhale, should contract. Feel the lower back, feel the hip as we twist the trunk. Roll the left shoulder back. Slowly come up. Hold the top of the chair, bring the right foot down. Chain. Left leg up. First stretch the spine. Keep the left foot on the center of the chair. Now inhale, exhale, turn to the right side, taking the left hand down. From left hand, hold the foot of the chair. Right hand on the waistline, twist the trunk, well open the chest, move the right shoulder as back as possible. So this combination of movements would engage all the intricate muscles connecting different units of our body. Slowly come up, hold the chair, bring the left leg down, sit on your heel, using the chair as a support. Helps the joints to experience a good loading through which they can become stronger and healthier. One more time, kneel down, take your right foot up, right foot at the center of the chair. Now inhale, exhale, turn to your left side. This is different from what you did earlier. The direction of twist is changed. From left hand, hold the foot of the chair, right hand on the waistline, twist the trunk. So we are providing the twist in both the directions for the hip and the trunk complex. Other parameters also you should observe. You should tighten the knee capsule on the right side. Left leg also active. Now slowly come up. Hold the chair, bring the right leg down. Chain, left leg up. Left foot at the center of the chair. Inhale, exhale, taking the right hand down, twist the trunk. From right hand, hold the foot of the chair. Left hand on the waistline, twist the trunk. As you can see, apart from the hips, it also helps the complete back, the shoulders also. Be focused on your breathing. Slowly come up. Hold the top of the chair, left leg down, sit on your heel. Watch your hip. One more time, kneel down, take the right foot up, right foot at the center of the chair. Now hold the seat of the chair from both hands, rise the left knee up, stretch the left foot backward, back of the toes resting, hold the top of the chair. Watch the loading on the ankle and the hip as well as the knee, chest and navel up. Left leg absolutely straight. So you get a good loading on your knee and hip, also the foot. Slowly flex the left knee, come down. Bring the right leg down. Chain, left leg up. Left foot on the center of the chair. Hold the chair from both hands. Straighten the right leg, toes pointing back. Hold the top of the chair, chest and navel up. Orient the trunk properly. And feel the hip, knee. They get a good loading to bear. Flex the right knee. Bring the left leg down. One more time. We will introduce one more challenge to the posture. Right foot on the chair, left leg straight. Now stretch both arms up. Left leg absolutely straight. Now feel the hip complex. Feel the knee. Flex the left knee, come down. Change. Left leg up. This does a great deal of help to the knee and hip joints. Left leg up, right leg straight, stretch both arms up. Feel the posture. Right leg absolutely straight. Right foot also gets a very good movement and load. Flex the right knee, bring the left leg down. So this helps the ankle joint, the foot joint, the knee joint and the hip joint in not only giving flexibility but also giving a good deal of strength. Sit upright on your heel. Feel all these joints in the lower extremities. Go deep into them, feel them. Again, kneel down. Take the right leg up. Now fold the right leg on top of the chair, resting the knee on the seat of the chair, foot out of the chair. So right thigh parallel to the seat of the chair. Chest up, navel up. So the way the leg is folded, that is different. You should watch. The knee, bulk of the thigh and the leg, they are resting on the seat of the chair. Foot is free out of the seat. Take your right leg down. Change. Left leg up. Fold the left leg on the seat of the chair. Ensure that the left thigh runs parallel to the edge of the seat. Knee on the seat. Foot out of the seat. Chest and navel up. So hip experiences different movement here. Just watch that. Bring the left leg down. One more time, right leg up. Fold the right leg on the chair. Thigh pointing forward. Then inhale, exhale, bend forward. That is, tilt the trunk forward. Breathe well. Hip in this case is in more of a flexion. That is the right hip. Slowly come up. Right leg down. Change. Left leg up. Note the positioning of the leg Inhale, exhale, tilt the trunk, feel the stretch in the hip, back. You have to stretch the spine, do not buckle the spine. Slowly come up, left leg down, sit on your heel, breathing relaxed. Kneel down one more time, take your right leg folded on the chair. Bend completely forward, taking the trunk underneath the top rib, and then stretch your left leg, left toe pointing backward. Feel the stretch in the hip, right hip going towards a near complete flexion, left hip going to a good deal of extension. Flex the left knee, bring your right leg down, change, left leg up. Fold the left knee on the chair, thigh parallel to the edge of the seat. Take the trunk underneath the top rib, bend forward, extend the right knee, stretching the right leg, right foot pointing backward. Stretch the spine. There are 600 odd muscles in our system, connected in various ways, and doing these postures would engage these multivarious muscles which are in the form of some kinetic chain, so that the complete chain becomes healthy. Flex the right knee, hold the chair, slowly come down, bringing the left leg down, sit on your heel, sit upright. Take out the blanket, sit on the chair, sit upright. Do not lean against the backrest of the chair. Sit upright. Now take both the foot on the seat of the chair and join the foot. Press the knee down. This is a good sideward movement for the hip. So called the hip abduction. Chest and navel up. Feel the groin, breathe well, feel the pelvic cavity, abdominal cavity as we inhale and exhale. Squeeze the back of the thigh against the calf muscle, so that the fascia of the knee is felt. Now release both the legs, rest the foot on the floor, sit upright, palm facing upwards, tip of the thumb and index finger in contact, gently close your eyes, feel the region of the hip, region of the lower back. Namaste.